What if I told you that there's some fillers that are longer lasting and that may actually give you a more regenerative and rejuvenating effect? Hi, my name is Dr. Kim, and I'll be talking about sort of the non-HA, the non-hyaluronic acid fillers, which may help you on your facial rejuvenation journey. You probably heard of HA or hyaluronic acid fillers for the go-to in terms of filling, sort of sculpting your face. They're by far the world's most common fillers. They're easy to deal with in terms of surgery as well as with rejuvenation. And they're actually sort of easy to melt and deal with in terms of complications. Imagine having a filler that lasts for not just a couple months, let's say 6 to 12, but for up to 60 months or even forever. So these are the fillers that I'm talking about. We'll go through each of the major ones in terms of the chemicals, as well as the advantages and disadvantages of each. We'll be looking at Sculptra, Radiesse, Bellafill, Renuva, as well as your own fat to really give you longer lasting results, sort of different options in terms of what we can do for your face versus just HA. So what sets these non-HA fillers apart from HA is that typically non-HA fillers, we're really sort of looking at your overall face. They're wonderful for reinflating your face for overall holistic facial appearance. They're really not used to fine-tune your face as much compared to HA fillers. So for example, the non-HA fillers, we're really not giving them to just plump up your lips or to look at specifically the under eye area. Rather, we're looking at the overall face, including the jawline, the cheeks, things of that nature in terms of the overall facial appearance, in terms of giving you the best result. Think of these fillers as restoring your overall facial volume, as opposed to just fine-tuning it in very tiny areas. So in terms of facial rejuvenation, we always need to think ahead. So in terms of a facelift, we really don't like scarring of the SMAS, the SMAS, the superficial muscular aponeurotic system. That's the tissue or structure that's underneath the skin that I'm sculpting and tightening when you get a facelift. So if you get a facelift, you want to avoid excessive scar tissue in that area, and I'll give you some hints as to how to avoid this with these types of fillers. And also in general, you want to avoid too many surgical threads or too frequent of surgical thread application, because these tend to also give scar tissue in the SMAS area. So the first one is Sculptra, PLLA, poly-L-lactic acid. So that's an absorbable compound. In other words, it does dissolve over time. Typically it's mixed in a vial, and then we inject it into the cheek and facial area. And what it does is it plumps up your face. Now, of course, if you give too much, it'll look too plump. So you want to be careful. You want to sort of not inject, vials and vials and vials every week. You want to discuss it with your injector as to the appropriate amount for you. The disadvantage of Sculptra is that it can't easily be melted. In fact, I'm not aware of really any great way of consistently melting it. So you do want to be careful about overfilling your face. Next up is Radiesse, also known as calcium hydroxyapatite. So this is a great filler. It should last about 18 months in your face, and it does have a biogenerative or rejuvenation effect. The disadvantage of CAHA, calcium hydroxyapatite, is that it is difficult to actually melt. So definitely discuss this with your injector. Typically, if there's an issue, you want to dilute it with saline injection. There is a way to melt it using other agents, and you want to be careful in terms of nodule formation. Definitely discuss it with your injector to see if this is right for you. Next up is a very cool substance known as Bellafill. It's made out of PMMA microspheres, or little balls, along with collagen. PMMA stands for polymethyl methacrylate. And so what it does is it gives sort of long-term induction of collagen into a specific area. The collagen is actually done so that you have an instant or immediate result, but that fades over time, over the next couple of months. While it fades, the PMMA induces collagen to grow exactly where everything was injected. This stuff is great because it lasts for 60 months, 5 years. The disadvantage is that I'm not aware of any great way of melting it in case you're not happy with it or it forms a nodule. So definitely talk to your injector about this. So Renuva is best for very thin patients who have very little body fat. It's actually cadaveric fat that has been processed, and it's placed into 3 cc syringes. When you open up the box, you actually are able to see the syringe and see that it is fat. The other disadvantage of Renuva is that I think that more of it gets absorbed than your own fat. So I think only about 50% is retained if you use Renuva. But it is a great substance. It should be long lasting in terms of years, probably technically forever. And it's very natural because it's a fat derivative. Now, last but not least is fat. So if we get your own fat through liposuction or fat harvesting, process it and place it into you, known as fat grafting, you have a very long-lasting, natural substitute for your own volume. Fat is great because you have some, or you probably have some, as well as the fact that it has a slight stem cell effect because there's still some stem cells in your fat, so you look more rejuvenated. Fat's also very versatile because we can liquefy it, we can partially liquefy it, we can actually have it in solid form. So depending on where it is on your face or body, we can actually process or filter your fat properly so that it gives you the best result. Now, fat's a little different from the other fillers that I mentioned. Even though it's your own body's natural tissue, I would say that only about 70–80% of your own body's fat actually sticks around after we're done with the procedure. In other words, about 20–30% gets absorbed by your body or broken down. The good news is that your own body's fat, once it sticks around, it tends to stay around for decades or longer. So, are you ready for some of these non-HA fillers in your facial rejuvenation journey? Just remember, the non-HA fillers do offer some incredible advantages. Typically, they're great for holistic approaches to facial rejuvenation, and they also tend to last longer than just HA. I think some of the disadvantages are they don't last that much longer compared to HA, and sometimes they're difficult or impossible to actually remove or to melt. You don't want to burn any bridges, so definitely talk to your injector about potential future facelift surgery, damaging the SMAS, creating scar tissue and things of that nature, so that you don't look just rejuvenated today, but you'll continue to be able to look rejuvenated in the future. Definitely consult with a board-certified plastic surgeon to find out the best options for you. If you like this talk, here's a great video on facelift where I explain, if you're a candidate for facelift and other considerations. As always, thanks so much for watching. If you have any other topics or questions, please drop them below, and have a great day.